Patient placement. When transferring the patient to the rotaprone, follow all facility protocols and universal precautions. Do not leave the patient unattended at any time during the patient placement. Position the patient on the rotaprone surface and center their head within the head support. Align the patient's ears with the openings in the sides of the head support pack by slowly closing the head pack to lightly touch the patient's face. It is very important that the patient's ears remain aligned with the openings in the head support. Proper positioning and alignment of the head and ears determines optimal support for the patient head. Check the head position often during the remainder of the patient placement procedure, especially when all other packs are positioned and tightened. Turn the black knob on the head support clockwise to tighten until the sides are lightly touching the face. Then center the patient's body on the surface. Route ventilator tubes and other upper body lines through the opening at the head end of the bed and secure the lines into the tube management system. Secure the ventilator tubing in the designated opening within the tube management system on the opposite side from where the ventilator is positioned. Once all lines and tubes have been placed in the tube management system, press the black button on the left side of the hatch to close the hoop. Next, route chest tubes, Foley bags, fecal management system, sequential compression devices, and any femoral place central lines through the opening at the foot end of the bed toward the main display panel. Do not hang or tie any equipment on the sides of the patient support frame. Use the hand control remote to adjust the patient's surface to the lowest level if raised during patient transfer. Now you're ready to place the support packs on the patient's surface. All support packs and the face pack are required for prone positioning therapy. For supine rotation, the lower leg prone packs and either the chest or pelvic prone packs are required. First, install the leg abductor pack. This helps to support the patient's feet and legs and to ensure proper positioning at all times during rotation. Separate the patient's legs and position the pack. Set it onto the patient's surface and insert the pack posts into the receptacles. Push the posts down into the receptacles and pull and turn the lock pins on the post bracket to release and lock the pins in place. Then adjust the foot positioning pack, footboards, by lifting the pin and sliding the foot pack until it touches the heel of the foot. Route the lower body catheter lines through the midline notched areas at the bottom or top of the leg abductor pack. It may be helpful to utilize both notched areas if there are multiple lines involved. Make sure the lines have adequate slack to avoid pulling or tangling during rotation. Next is the placement of the side supports. In order to optimize the fit of the side supports, determine the shape of your patient by assessing the width of the hip in relation to their chest. Each of the side supports have a concave and convex side. For example, for an individual with pronounced hips, the concave side of the side supports should be placed toward the patient. For an individual with narrow hips, the convex side should be placed toward the patient. The side supports are interchangeable and can be used on either side of the patient. Choose the best fit for the patient, which can help minimize patient migration during rotation. Extend the patient's arms 90 degrees to the side while positioning the side supports. The side supports can also be placed in two different positions at the front end of the surface. You can choose the inside or outside guidepost to accommodate for the patient's upper body. Placing the end of the side support in the inside guidepost will provide for a wider upper body range. Placing the end of the side support in the outside guidepost will provide for a more narrow upper body range. Now you will need to unbuckle the arm slings located on the side supports. Place the patient's arms into the arm slings and buckle them closed. This will help secure the patient's arms during rotation. Utilize the hand crank on the patient's right side of the surface to center the patient and tighten the side support packs snugly against the patient's side. Packs need to be tight enough to prevent the patient from sliding from side to side when rotated. Snugness of the packs will vary according to each patient's body type. Recheck each time the patient is moved from supine to prone. Insert a hand between the side support packs and the patient's thighs and hips as the packs are being positioned. When the packs feel snug against the hand, remove your hand and ensure the patient is secure. For smaller patients, the top end of the side support packs can be extended to support the patient's thoracic region. Pull up on the knob on top of the side support and extend the pack towards the patient's axilla. Insert the U-shaped pads into the gap to protect the patient's skin. Be sure to leave 2 inches, approximately the width of 2 fingers, between the end of the pack and the patient's axilla to help reduce any pressure on the vessels and nerves. Once the side supports are in place, the abdominal sling can now be placed. The abdominal sling will help to support the abdomen during rotation. Place the abdominal sling on top of the patient with the Velcro strap facing up. Be sure to look at the diagram to ensure it is placed properly. Feed the Velcro straps through the gray loops or bridges located on top of the side supports and angle them away from the patient's skin when securing them. Next, the accessory inserts will be added to customize the fit of the therapy system to the individual patient's size and shape. Each accessory insert is labeled with a diagram of where the insert can be placed. However, individual packs can be interchanged to accommodate patient body types or critical lines. Start at the front end of the surface and move toward the patient's head, ensuring to place packs over shins, hips, and chest.